Hi viewers, I am Dr. Padmavathi Surapaneni. I am a practicing dermatologist and a cosmetic dermatologist. I practice in Hyderabad at Pragna Skin and Laser Clinic, Hyderabad, Telangana. Today I want to discuss about unwanted hair or hirsutism. Unwanted hair is like if the girl sees coarse and thick hair on the face or other areas of the body where normally a regular girls doesn't have, which is like a male pattern of hair growth, like on the upper lips, beard area, lower face, and then chest and the upper back. So this hirsutism can be of two types. It can be just a simple hypertrichosis, that is, it runs in families. A few girls in the families may have unwanted hair in these areas, like it should be usually of fine hair. So if you see their mom or the paternal aunts, some of them may be having this type of increased hair growth where we call it as a hypertrichosis. It is not at all like pathological, like there is no insulting factor which can cause the hair growth. That is their familial hair. Other type of hair is a hirsutism. Hirsutism is because of some stimulation, some abnormal hormonal imbalance which can cause unwanted thick hair in these areas. So when a girl comes with the hirsutism, then it is our thing to see what is the cause of the hirsutism. The most common cause of hirsutism nowadays is the hormonal imbalance, and of the hormonal imbalance the commonest was the polycystic ovarian syndrome. Polycystic ovarian syndrome is a problem where the ovaries have multiple follicles which form into a cyst, and then they secrete abnormal hormones. Normally when the girl matures, the ovaries secrete hormones, both male and female hormones, but there will be predominance of the female hormones than the male hormones, so that their traits and the hair distribution, everything will be like a female. But when there is some problem like a PCOS, these cysts may secrete hormones where there may be an excess of the male hormones, mostly the testosterone and maybe other type of androgens. So this can stimulate unwanted hair as well as other problems of hirsutism like coarse voice as well as hair on other areas and thickening of the clitoris. All these problems you can see. So other common cause of hormonal imbalance can be an adrenal, like a Cushing's syndrome or a congenital adrenal hyperplasia, or some tumors in the pituitary or in the adrenal. And other common cause is the drugs. The most common drug is the steroid. If the patient is having some problem, some chronic problem, your physician might be giving you some steroids, like a systemic steroids, for a long time. This can cause unwanted hair growth on the face and also on the body. And nowadays, commonly what we are seeing is unwanted hair on the face because the girls use over-the-counter or unnamed fairness creams which contain the topical steroids. The steroid abuse will cause, initially the girl may feel very good because it causes smooth and fair skin, but on the long run it can cause unwanted hair on the face as well as acne. So when a girl comes to us with a problem of hirsutism or unwanted hair, first thing what we do is first to investigate and see the reason why the girl is developing this unwanted hair. So we go through some blood tests like the female hormones and the thyroid hormones, and then all the hormonal profile along with an ultrasound to detect if there is any abnormal cyst or follicles, or there is any abnormal growth in the adrenals, pituitary and everything. So once the diagnosis is confirmed, then we treat accordingly to first control their hormonal imbalance. Nowadays most commonly what we are seeing, like 80-90% of the girls are suffering with PCOD. So when we detect a PCOD, first we'll start her on oral contraceptive pills to reduce the PCOD, and then maybe at least for 3 to 6 months, and then we start the hair removal techniques. So if the hormonal pills itself they are not able to reduce, then we may give some anti-androgens like spironolactone also we add along with these OCPs. Once we feel like the hormones are coming under control, then we start doing the permanent hair reduction treatments. Only two approved treatments for permanent hair reduction. One is an electrolysis, in which your technician may pass a small needle with an electric current into the individual hair follicles and then burn the hair follicles so that the hair will go for permanently. But this type of electrolysis is a little bit tedious and then maybe painful, and it takes long time. The most approved and accepted way of hair reduction is the laser technology. There are different types of lasers which you can opt when you want to get rid of your unwanted hair. One of them is the long pulse Nd:YAG laser, other one is the diode and the Alexandrite lasers. The Nd:YAG lasers are more safer in the darker skin people like our Asians, and then the burns will be less and it targets more deeper areas, but maybe after a few sessions a little bit of fine hair may remain after the Nd:YAG laser sessions. And other is the diode, which is a more standard laser which targets the hair follicle. It is an 810 nanometer wavelength hair laser, and then in this type of lasers the hair reduction will be more efficient than the long pulse Nd:YAG laser, but this can be cause a little bit of burns in very dark skin, so you have to be very careful when we are doing a very dark skin people with the diode lasers. Alexandrite laser is also the same. It is a very efficient laser for hair removal, but is meant for only very fair skin people. Nowadays there are lasers which are called as a triple combination lasers, which have a wavelength equal to like Nd:YAG laser, diode laser and Alexandrite lasers. These lasers can emit the wavelength which is a mixture of all the three lasers, so that a part of each laser, like 40% of Nd:YAG, 40% of diode, 20% of Alexandrite, like that we can combine depending on the type of the skin and depending on the type of hair you have, and then we can do the laser. So this gives a more permanent and more easier clearance of your hair with less side effects, without burns and without pain. So this is the latest technology which is available for unwanted hair reduction treatments. So whoever have this unwanted hair problems, just go and consult your doctor. But with my experience, what I am seeing is most of the girls who are having unwanted hair, about 60 to 80% of the girls are with the PCOD problem. PCOD problem is normally a lifestyle problem. More of sedentary life and then weight gain are the main reasons for the PCOD. So change your lifestyle, do exercise, workouts or some type of sport, and eat healthy and be healthy. Then you can avoid this PCOD and you can avoid this unwanted hair problem also.